Welcome to ETMC TV and this informative presentation by Todd Parrish, MD, board-certified orthopedic surgeon who treats patients at ETMC Jacksonville and ETMC Henderson. Dr. Parrish will discuss hip replacements. Thank you for choosing ETMC TV.
Usually we run into a patient that has had some hip pain for some time and has had some increasing stiffness for various reasons. Most people are over 50 years old that begin having these problems. Some people have problems just from wear and tear. They put a lot of miles on their hips in their lifetime with their job and all their daily activities, and some of those people slowly develop arthritis from that. When people have reached the point where all the conservative measures of activity modification and taking anti-inflammatory medicines, and some people even having corticosteroid injections in their hips, if they've reached the point where those conservative measures really aren't helping enough, then often they've reached the point where they need a replacement of the hip joint. The main reason to replace the hip joint is for pain relief. It improves their function because most of the time when people have arthritis in their hip to that degree, they lose a lot of their motion as well. A few people have had hip dysplasia when they were young, and their hips wear out because of that, or they have some deformity. Some people have enough deformity that they have a limb length inequality, and you correct that as well. We run into people that they have a hip that wears out and it's really painful. When you examine the other hip, they have no problem with that one, and often they don't have a history of any other injuries, or it's hard to put your finger on a reason why one hip joint will wear out as opposed to another. Then some people, they have hip pain in both sides equally. Some people that have reached an advanced age, their issues with falling is they have some balance problems and some muscle strength problems, and the less disability we can give them with our surgical approach, the safer they are after they've had the procedure early on and throughout the time that they use that joint. Typically, if someone is older and they have a lot of different medical comorbidities, their internal medicine physicians, we have them do a preoperative assessment to make sure we're safe to do the surgery. We evaluate their x-rays and we evaluate what their motion's like and talk to them about their symptoms and what their expectations are from the surgery. Some people with the arthritis in a hip or a knee, their main symptoms are when they're being active. They don't have any pain at night, anything like that. Some people prefer to do a posterior hip approach. It's been used for a very long time. It's a very good approach. It does minimal damage or minimal injury to the muscles. One of the worries with the posterior hip approach is there's a little higher rate of dislocation of the artificial implants. One of the other approaches that's very popular that we've done for a long time is an anterolateral approach, but it involves taking down part of the muscles that stabilize the hip and give you hip strength. And once you place the implant, you have to repair those muscles, and that's part of the length of time it takes you to rehab and get your function back and get your strength back, is to have those muscles heal and make sure they heal to the bone. So that can add extra pain and more of a struggle to get your function back. Some people have a procedure done where you place part of a hip replacement. They don't have significant arthritis in the acetabulum of their pelvis, but they have a fracture that's severe enough and displaced enough that it won't heal with regular fixation. And you do the same approach and place the same implant just like you would if you were doing a total hip arthroplasty. And we really like that. It's a pretty quick approach, and it's pretty easy to get the implant in. Some people that are much older and have multiple medical problems, the amount of time you spend doing the surgery is key. Some people, depending on their situation at home, if they have someone there to be with them and help take care of them, they'll go home initially, and then home health will come and do physical therapy until they've reached the point where they're mobile enough that they easily get in and out of a car. Those people typically transition and come into the outpatient physical therapy at that point. Some people that don't necessarily have family at home or family that can help take care of them to the point that they need will go to the rehab hospital, and they go through physical therapy there until they're way more mobile and they're close to being fully independent, and then they go home and they have physical therapy either at home or in an outpatient basis.
Dr. Parrish sees patients at the ETMC First Physicians Clinic in Jacksonville and the ETMC First Physicians Clinic in Henderson. He received a bachelor's degree from Stephen F. Austin University before attending the University of Texas Southwestern Medical School in Dallas. He completed his residencies in both general surgery and orthopedic surgery at the Wilford Hall Medical Center on the Lackland Air Force Base in San Antonio.